Hi, my name is Nora Gardner. I'm a licensed clinical social worker and a therapist at Creative Family Counseling, specializing in trauma-focused therapy. Today I'm going to share a little bit about how I help clients figure out a plan for therapy when they're untangling past trauma as well as another possible mental health diagnosis. Trauma-focused treatment focuses on helping someone understand how their reactions now might be shaped by things that have happened in the past. Specifically, events that have overwhelmed the capacity to cope. So trauma can be connected to individual experiences, or it can also be connected to experiences that are collective or systemic, like racism, sexism, homophobia, or ableism. Sometimes trauma reactions can look like symptoms of mood disorders or other diagnoses, and they might be misunderstood. For example, hypervigilance, or being really aware of danger, which is really helpful when you're not safe, can look like anxiety. Or in children, it can sometimes mimic symptoms of ADHD. Dissociation, or emotional numbness that is protective against overwhelming experiences, can look like depression. And then sometimes we have past trauma or overwhelming experiences as well as another diagnosis like anxiety or depression. In that case, we work on building coping skills and building the relationship until it feels safe to process the trauma. And then we focus on getting that off of your plate so that you can see more clearly what additional needs might be met. In order to understand what might be trauma and what might be something else, the best tool in the therapy room is a safe therapeutic relationship with your therapist that lets you work together to figure out how to understand what's happening for you. One helpful analogy can be to think of your current challenges as a ball of yarn. And so you're holding one end with the expertise on yourself, and your therapist is holding the other end with their knowledge on trauma and mental health, and you are working together as equals to slowly untangle that ball. I hope this is helpful.